Welcome to the Kaleidoscope, Healthcare in a Diverse America, from molecule to market, with your host, Sheila Thorne. Each episode highlights healthcare leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Hello, and welcome to the first episode of the Kaleidoscope for 2024. The topic today is media, and it's not about general mainstream media, it's about ethnic media, and in particular, media that focuses on reaching the African American community. How can we effectively reach communities of color with health information? Certainly, the internet has opened us to increased access to a wide variety of audiences, including people of color. But there is a cultural deficit in the healthcare industry with how best to use those devices to reach people of color. Along with the internet, we have a proliferation of misinformation, no information, conspiracy theories, fake news. That's daunting. And health information clearly falls into those buckets as well. From a media perspective, in my 27-year career in this space, there is most definitely a cultural deficit in the part of marketing communications experts and media buyers with regard to ethnic media. There's been this stereotype that ethnic media is not audited. And so there's no value in using all of the outlets and the publications that are available to reach African Americans. Nothing could be further from the truth. While there is an abundance of free health information, most of it is not useful for people of color. Most of it is not only not useful, it's misleading. And so that trust factor kicks in again as to who really is the source of the information. Are these outlets trusted messengers? Are they messengers that you can trust will deliver important health information? I was at a meeting last year in Washington, D.C., where there was a presentation by a member of Health and Human Services, and they talked about their $17 million budget to reach people of color with health information, with brochures. I raised my hand during the Q&A session, and I said to the lady who was presenting very impressive materials, I never see any of that in my community. Imagine $17 million. And what she really explained was what I call drive-by ethnic marketing. You just put a black, a brown, a yellow face on a brochure, print up a lot of them, and dump them in the community. But do they ever get into the hands of the people who need it the most? I've been a senior executive in 5 major, nationally preeminent marketing communications companies, and ethnic media, ethnic magazines, ethnic newspapers are never on the media list, nor are they sought by the media buyers. That's got to change. If you want to get information to people of color, you must partner and collaborate with trusted vehicles and trusted messengers. Extremely important. We have the super information highway, and you have driven by communities of color. It's time to get in the mix and make sure your message is culturally relevant, the pictures are culturally appropriate, and you have information that communities of color can use as they talk to their healthcare professionals, as they try to improve the health and wellness of their communities and their families. Well, I am honored today to bring to you 2 veteran, trusted messengers, media experts who have been in this space for almost as long as I have. In fact, they're going into their 24th year. I have the publisher and co-founder of the Positive Community magazine. Please join me in welcoming Adrian A and Jean Wells. Join me.
Oh, good afternoon, Sheila.
Hello, Jean. Hi, Adrian. How are you?
Nice to see you.
Good to see you, Sheila. Thank you so much. And we're happy to be the first guest of the year.
Yes, indeed. Well, I'm honored to have you both. And we've known each other for quite a long time, Adrian, and certainly the work of Jean is now. Is there a way to turn that phone off?
I am, yeah.
Okay, great. Thank you so much.
I don't know.
Well, before we get into our conversation, let me tell you a little bit about Adrian Council, who is the co-founder and publisher of the Positive Community magazine, and he's going to talk to you about that. Adrian has more than 25-year career, starting as an undergraduate in upstate New York in Rochester with the radio station WWDKX-FM while he was still an undergraduate, so he started early. Upon graduation, he had a position with Inner City Broadcasting Corporation with the legendary WLIB and WBLS, certainly renowned in New York City. And then he took that position and he partnered with Gene Wells. I'm going to tell you a little bit about Gene in a minute. But Adrian has been a stellar leader with regards to the faith community and health. And he's been involved in both. And that's clearly important for you to know that he has a face as a trusted messenger. He is co-chair of the African Americans for Diabetes Awareness Committee, which is a volunteer organization that has been supported and endorsed by the American Diabetes Association. He's received the Corporate Citizenship Award by Omega Psi Phi, one of our leading Black fraternities. He's received the Community Service Award from Baptist Ministers Conference of Greater New York and vicinity. And he and Gene both are involved in the African American for Health Awareness. So it's not just about information, it's about relevant information and health. So kudos to you, certainly, Adrian, for being a part of this journey that we're both on. Now, Miss Gene Wells. Gene Wells is a veteran marketing communications, public relations professional. She started early on with Children's Television Workshop, producers of the PBS program, and has done stints with WLIB, WBLS, Showtime at the Apollo, and I can go on and on. She had a full service public relations agency, and so partnering with Adrian was a perfect fit. She too has received community recognition, New York State Community Distinction Award, National Council of Women's Executive Leadership Award, Legend Award from the New York Coalition of 100 Black Women, and the Heritage Award. So I can go on and on about both of them. But as soon as you hear them speak, you'll know why I am hoping that you will reach out to Gene Wells and Adrian Council as trusted messengers to deliver health information to the Black community. Adrian, let me start with you. Why did you begin? Why did you embrace this lifestyle magazine with faith and community? Why did you do that?
Well, Gene and I worked together at radio station BLS and LIB. Actually, Gene was my general sales manager at the time that I was an account executive. But we basically, as we went on throughout our careers, that we saw that there was a void in this age of modern technology and information, that the African American faith community does not have a vehicle through which they can communicate what's happening in the Black church. And so we started the magazine in the year 2000, and we've been publishing ever since. Why? Because we deliver good news from the church and the community. And so our publication is distributed in bulk to large congregations throughout the New York, New Jersey region.
Well, talk about the faith community, because the pharmaceutical industry and healthcare industry in general has always jumped on going to the Black church as a vehicle to get information out. Why is this phenomenon so critical for healthcare executives to understand?
Well, I'll tell you, I served for a while with the American Diabetes Association. I was a co-chair of the African Americans for Diabetes Awareness. And we had these programs, Diabetes Sunday programs, where we had a group of volunteers. We went to churches on Sundays. We spoke for 5 minutes, handed out material. And as it turned out, we were very successful at it. As a matter of fact, we became the American Diabetes Association's #1 African American program. And that was in the state of New Jersey. So we're really, we find that those in the Black church are very sensitive to matters concerning health, concerning the education of their children, concerning all matters. When they purchase a car or buy a home, they were blessed to purchase a car or buy a home or take a vacation. And so we're really proud to represent our community in this capacity.
And don't you go beyond the church, Adrian, in terms of community-based organizations? And
absolutely. We're in colleges, we're in schools, we're in small businesses, large businesses. the fact of the matter is that what makes us so strategic is that businesses as well as churches, they purchase the magazines in bulk, and so we're not waiting on a newsstand for somebody to come and buy it. Because today magazines would be very expensive on a newsstand, about $6 or $7. So
Yes.
they go directly to the congregations, and the congregations give them out, like Abyssinian in Harlem, or Allen AME in Queens, and First Baptist at Lincoln Garden. People really scramble for the publication because they see themselves in
Yes.
this magazine. So, as Gene would say, we're not celebrity driven, but we're community driven.
Love it. Love it. Love it. And how many times a year do you publish?
10 times.
10 times a year.
We do a combined issue for January, February. We do a combined issue for July and August. But we're on every month after that.
Exactly.
In between that. So we're proud of the work that we do. And
you should be. You should be.
Response to us.
And we're living in an age when people say, well, nobody reads magazines and newspapers anymore. That's old school. Why should you even bother to do that? I remember sitting in an outdoor cafe in San Francisco waiting for a meeting to start, and I was going to order something to eat. The waiter came up to me and he says, wow, that's not something you see often. I said, what is that? Somebody reading a book.
You're right.
Well, the interesting thing about it is that what I think that what we may have gotten away from is that when you go online and you read a publication, you turn the pages, whatever, you generally go to it once. But when you have a magazine sitting on your nightstand or sitting on your coffee table or your kitchen table in the bathroom, wherever, you'll find yourself reading it for maybe a week or so.
Right.
You see a story, hey, I want to see that. And so I think it's exciting, and we should not play softly on the fact that this is an important medium and people like to feel and touch.
Exactly.
Over and over again, we get those comments. And we did the last year around this time, Dr. Calvin Butts passed away.
Yes.
And we were blessed with the family giving us the sanction to do a special issue on it. It was just the most amazing response, in that people were taking the magazine, wrapping it in cellophane, and putting it next to their Bible at home.
Yes. Yes.
And so we create those kinds of opportunities, and also because we love and care about our people.
Well, there you go. That definitely is the heart of it. Well, Editor-in-Chief Gene Wells, tell me about your role and the editorial content that you're often seeking on health information.
Well, of course, we are always interested in providing information and real information. We're not interested in the internet is full of all kinds of hacks.
Exactly.
You can do to lose 2 pounds, and there a lot of them are fake. They're not true at all. But we have fortunately we have great relationships with several hospitals in the area. And so we've done roundtables, we've done other kinds of things. A couple of years ago we put on what we called a healthy hip hop conference, and
Get healthy hip hop.
Get healthy hip hop. And we had some of the old timers, some of the first hip hop people, with Cool J Herc, Adrian, and some of those people who came and explained to the students where we were at the Essex County College in Newark. And they explained to them the mistakes that they had made growing up and being involved in the hip hop community, the problems that they suffered as older people because of the health care that they didn't get.
So you're connected to community. You just don't put out an issue that is an autonomous standalone. You connect with community.
We connect and we check that the information that we are putting out is correct.
Well, that's important.
We do have a couple of regular columnists. We have a young person who is now a pastor, but he does a column on it's really about fitness, but he deals with the total body.
Okay.
So he also talks about what you need to eat,
Mhm.
and the kind of exercise that you need to do.
Mhm.
And it's usually, the easy things that you can do to stay healthy.
Well, there you go. That's the lifestyle part of what you do.
Yes,
And health
exactly.
is an integral part of that. So it's not only, it's mind, body, and spirit.
It
So that,
definitely is.
so
Yes, it
you see
is.
that holistically. Sarah, I don't know if you can pull up the cover while I'm talking to Jean, but that would be great. So we're in this social media world now, okay?
Yes.
We're clearly pushing that as if that's the only way to reach people of color.
Right.
But how has the positive community adapted to that surge of social media focus?
Well, we have a very vibrant social media plan. We do all of the social media. We have a website
Mhm.
it's updated every day. We do Facebook, Twitter, and Instagram. You can find
Mhm.
us there or all the time. You can read the entire magazine, flip the magazine online and read it, just like it's not that you're just swiping pages, but
Yes.
you can actually turn the pages and see the magazine in its whole. And we are beginning to expand
Hmm.
our reach in Instagram and Facebook.
Okay.
We
Excellent.
recognize the value of um, those platforms, and
Hmm.
so we're keeping up. We're keeping up.
Well, you're not only keeping up, you're ahead of the game. Because in our
Well,
community, you have to be. Adrian?
yeah, I was just saying, I was going to say that I was at a meeting this morning in Harlem at the Renaissance, the Victoria Renaissance Hotel
Hmm.
on 125th Street. I ran into a pastor of Union Baptist Church
Hmm.
in Harlem, and he said to me that he's always a reader of the positive community, but
Hmm.
he went to seminary at New Brunswick Theological because he saw the advertising in the magazine,
There
and
you
now
go.
he completed his D ministry and he's on his way for a PhD.
Wow.
So
Yeah,
we
people refer to the magazine as the Happy Magazine. I
Uh-huh.
met a woman at an art show, one of our photographers, and she said, "Oh, you do the Happy Magazine, you do the Love Magazine," and that's how we feel about our magazine. And it is the Love Magazine. It's so for the love of who we are and for the
Yes.
love of our community. And we began the Positive Community name means that um, there's more to us than what you see often on Instagram and Twitter,
Yes.
and
Yes.
certainly on television and
Hmm.
in regular general media. There's more to us than that. Um,
That's an excellent point, Jean, because it's not either or. We're not saying totally discount mainstream, but you have a unique niche. You have a unique place. You're a trusted voice. And
yes.
so the more you can combine that kind of information, the more it's credible in our community. So that's key. But a few years ago, Adrian, you started something new. You've got a radio show connected with the positive community. Talk about that.
well, I actually it was right during the pandemic, and Gene called me into the office. He said, "Hey, Adrian, look, we have this guy who says he can start a radio station for us." And we began in what was it, Gene? 2000? I mean, 2020.
2020. Yeah.
2020. Yeah. Yeah.
2020, and we have not looked back since. It is absolutely our fastest growing platform. We
Wow.
have now a ministry of good music,
I
and
love
we
it.
play the best of everything in classic black. So
Love it.
we're really happy about that. The popularity is moving forward, and then also um, we're in our fifth year now of the Positive Communities Great American Emancipation Day Awards banquet
I was going to talk to you about that.
at the
Yes.
Robert Treat Hotel.
Hmm.
And every year we're packing them in. About 400 to 500 people are
Wow.
there. We
Wow.
celebrate who we are, whose we are. The
Mm.
fact that January 1st is one of the most important dates on the American calendar, especially for African Americans, because
Hmm.
the Emancipation Proclamation that
Hmm.
liberated over 3.5 million people was
Mm.
signed on that day in
Okay.
1863. So that is something that we're really, really happy about, and we're looking forward to seeing you there, Sheila.
Yes, I'm looking forward to it. And
Welcome.
members of my team as well. I've been an avid reader of the positive community, and you have graciously allowed me to contribute some articles. I remember one of the first one was, "Do you care about Obamacare?" And with you on that. So it's been a pleasure to be a part of the positive community family and contributing my expertise and experience. And that's what I want the listeners and the viewers of my podcast to know. You're the unsung heroes here. Well, you definitely are the ones that can be boots on the ground, feet on the street, in community, from a cultural perspective, not just a news perspective, but a community connectivity. And Adrian, how many people listen to the radio show on a weekly basis? Any numbers?
Oh, we're getting about 3,000 listeners now weekly, and that number's growing. And we're really happy about the response that we're getting from people. There are people, even in North Carolina, that said they don't even turn their radio off. They sleep with it all night. And so, people are catching up. They're catching on to it. Also, I just want to add, too, that Gene and I are working very closely with the National Organization of Blacks in Law Enforcement.
Yes.
And regarding health, we're putting together a series of roundtable discussions on public safety.
Excellent.
Which is a health issue.
Absolutely.
The violence and gun violence, domestic violence, mental health challenges.
Mental health. Oh, yeah. Serious.
Mental health challenges, all of that. We're looking to work with this organization and do a series of 4 throughout the course of the year. And we're just excited about it. We're meeting every week to discuss and plan. Phenomenal. And this is a really good group of people. But we have to take the matter of public safety as a responsibility for our people on our own terms. So we're inviting the church on this, but we're not limited to the church. We're inviting the hip hop community, business community, students, and everybody who wants to listen and wants a change, positive change, to tune in and be a part of this.
And I think that's important what Adrian said about it's not only the church.
Yes.
It's and it's not only we're faith-based, but we're not religious. And the magazine deals with lifestyles, people who go to church, and they're looking for hope. They're looking for ways to improve their lives, the lives of their children. They want everything that people who basically have the American dream and want to live, but often often it's not seen that way.
Exactly right. Well, Gene, let me ask you, our viewers and listeners who may be in the pharmaceutical industry, how best can they partner with the positive community to get device information, health product information, and disease information in your issues?
Well, it doesn't only go into the issues for people who want to do the digital media. We have that as well. But of course, advertising helps us do what we do.
Stay alive. Absolutely.
It helps us stay alive.
And I'll tell you, amongst the biggest customers that we have are the hospitals.
Hospitals, yeah.
Interesting.
Are the hospitals. St. Barnabas, Hackensack, Meridian,
Mount Sinai,
Harlem Hospital,
New
York Presbyterian, Brooklyn Presbyterian.
You're in the health space.
Yeah, well, people who care about health are going to find themselves in church, and at very least, they're going to be the ones that tell those who are not in church about health issues and matters. And that's why the American Diabetes Association did so well with us, because this is information that gets around.
Exactly. Well,
so we're really happy about that.
Well, the fact that you mentioned this person from North Carolina, even though your focus is New York, New Jersey, the Black community has tentacles everywhere. So anybody going to church in New York has folks going to church in Atlanta, has folks going to church in Oakland. So it's not just limited geographically. You spread your wings.
Well,
what happens is that even in the churches, a lot of members in the church, they get magazines and send them to their families who relocated to the South.
Yes.
And that happens very, very often. And
Wow.
so we're just looking very much. One of the things that when Gene and I started this publication, we asked ourselves, because we've been in Black consumer marketing and concept selling for years, but we said, what are the two reasons why people go to church? Why are the two? What are the two reasons? Because people want hope for tomorrow and opportunity for today.
Yes.
And our goal was to set out and create a media product that offers just those two things:
Wow.
hope for
And
tomorrow and
Adrian,
opportunity for today.
our idea was to give people a high quality
Yes.
publication.
Yes. And it
You
certainly
know,
is that.
yeah,
Yes.
not just a newspaper, but a magazine that gives us the full color of who we are all together.
And
And
now,
people don't throw magazines away.
no, you don't. Those are,
We've run into people who have kept every single issue for 25 years.
wow. Wow.
I'm telling you. So it's
Yeah.
and we're proud of that, but
Absolutely.
we are sincerely invested in moving our people forward, and moving the community forward, but also taking our sponsors and our advertisers and moving them forward and helping them to understand that our community, the African American community or the Black community of New York, is an ethnically or is ethnically diverse now.
Yes.
You know,
Yes.
you have your brothers and sisters from Africa and from the Caribbean, and we service all of them.
Well, it's interesting you make that point, because I think many who are in the mainstream world don't understand that dynamic. The fact that we talk to each other, we're connected with each other. And obviously, you're now a member of the National Newspaper Publishers Association with
That's
Dr.
right.
Davis.
Yes.
So, we're still reading. We're not all on social media. We can definitely reach out to that segment, but we are a group of people who want information, thirsting for information. But it has to be culturally relevant and culturally appropriate. And so that's how you build your credibility. And Adrian, you and I have talked about special inserts that you can do on a specific disease, special inserts. So depending upon the resources of our viewers and listeners, what's your budget like? What's your media budget like? Have you squared away some money for ethnic media, for the positive community?
Well, that remains a problem, though. It
It's a
remains
big problem. Can you talk about that? Why is that, do you think? Why aren't people reaching out to you?
Well, I don't really know. We
I
think
think that
better
today,
publication. Go ahead, Adrian.
I think that today people are so numbers driven
Yeah.
that we have souls. Our community, we have souls. How many people you reach? I've listened to radio stations where, well, one song you're cussing and carrying on the other song you're talking about crime and all of that, and then right in the middle of that you'll hear a commercial for an insurance ad.
Yes.
And so it's qualitative.
Yes.
My relationship and our relationship with Sheila Thorne is a qualitative relationship.
Correct.
Our relationship with our maker is a qualitative relationship. So we should never move from that.
Exactly.
We always must remain grounded in the relationships that we have and building upon that. And I think that advertisers are becoming more and more sensitive to the fact that no, it's not just numbers that you throw out, but it's also the quality of the relationship that you enjoy. And so one of those advertisers
I just want to mention this, that there are so many people who are in the media business who say that they represent the Black community, African American community. Just like a lot of other things, they have taken what we have and made it theirs without recognizing, and really, like Adrian said, going to the soul.
Exactly.
It's all about the dollars. It's all about the money.
It's all about the dollars. Well, I have an expression I use with my team. I don't care how much you know until I know. I don't care how much you know until I know how much you care.
Yes.
So
That's right.
You have the caring there. That's the element that the community is looking for. The media buyers, the pharmaceutical companies, the not-for-profit, voluntary, or the New York Times, Los Angeles Times. I mean, that has a role, but more Blacks may read the New York Post and Daily News, but they trust the positive community.
That's right. And one of the people that we're honoring on February 24th at the Robert Treat Hotel is a Fortune 500 corporation that came to us and says, hey, we want to advertise, but we don't want to just advertise. we want to set up a relationship.
Okay.
And they just done absolutely well with us.
Fabulous.
And well with our community. People love and respect them for doing that and supporting our business.
Well, and to Gene's point, even if it's about the dollars, I mean, you get much more bang for your buck advertising in a positive community than you would taking out a full page ad in the New York Times, which senior management seems to thirst for and like. But and that's important. It's a mix. It's a mix that you have to know your audience, know your target. So do you know about the positive community? Do you know about Amsterdam News and the Carib News and the Los Angeles Sentinel and the Atlanta Voice, the Chicago Defender? They've been around for decades, yet the industry ignores them. They undervalue them and they undercompensate them. That's got to change. Do you agree?
That's right.
Yes,
That's right.
absolutely.
And go ahead, Gene.
No, I was saying that's absolutely correct. And they value the market.
Yes.
They do value the market, but when they're not so in tune with what Adrian always talks about and I talk about is who we really are.
Yes.
We're not that all those people on the street who are shooting guns and, I want my children to go to college.
Yes.
I want a lovely home.
Yes.
I want a new car, and our market is different from what the average corporation wants to reach.
Absolutely.
It's just numbers.
Exactly right. So my appeal for anybody listening and watching this is how much of your budget can you earmark for the positive community in the year 2024? You've got 10 issues. You've got health observances in each issue, Diabetes Month, Cancer Awareness Month, Prostate Cancer Awareness Month. I mean, it's all there. So we're not asking for all your budget, but we're asking for what will represent how we reach our target audiences. Media buyers, wake up, get educated, understand.
I'll tell you something. One of the honorees that we're going to have is the FIN organization, Prostate Health Education Network. Not only did they advertise in our magazine, but they also connected with the General Baptist Convention of New Jersey or the Church of God in Christ, and they've conducted services directly with them, and the results are just absolutely astounding. And signing up and getting people to understand some of the dangers of prostate health awareness and so on and so forth.
Getting the screenings done. I don't think you do anything to have prostate problems, but the important thing is finding out about them.
Yes.
And having them cured. Know
your status. Know your health status. Know your numbers.
Status.
Yes. And what those numbers mean. And obviously our community has not been treated well by the system. So we need the positive community to kind of mitigate that distrust, so that we can demand quality care. Study after study after study supports what you've been saying. And quite frankly, last November, the Kaiser Family Foundation had a survey of about 6,000 Black, Latino, Asian, and indigenous populations. Do you know that racism is pervasive and discrimination is so pervasive that these folks told these surveyors that they have to look at how they dress before they go to their doctor's appointment? So they're prepared to be discriminated against and to have prejudice. So this has got to change.
Sheila, this morning something popped up on my phone from Dr. Ben Carson. And it was it was like several pages of information about memory loss and dementia and Alzheimer's. And this thing was telling you, do not take these medicines that you have read about and that they're giving to people. You need to take what we have. And this is what Dr. Carson says.
Interesting.
And I don't believe any minute of that. It's really.
That's another role you play. You're a filter.
Yes.
You're a filter. So when this information gets out there, we look to you to say, does this make sense?
Yes.
Is this supported?
Yes.
So you clearly have a role to play so that our community can be as protected as they should be in terms of quality health.
Yes.
And as I say, the Kaleidoscope is here to bring people like you, community advocates. You're involved in community events. You don't just produce a book. You're there. I see you. I bump into Adrian almost every time. Congressional Black Caucus, New York State Caucus. You're out there. You know and have the pulse of the community. So if any of you are not looking to ethnic media to support your marketing campaigns, your health education programs, you're missing a huge opportunity, because quality, affordable, equitable, accessible, culturally competent healthcare is not a privilege. It's a civil right.
It is.
So on that note, thank you, Adrian. Thank you, Jean, for being my guest.
And Sheila, we appreciate your passion.
Thank you so much.
Really, thank you so very much.
Well, you both, I feed off your passion and enthusiasm. So together we can make this work in our collective wisdom. So kudos to your longevity. 2000. Wow, it's 2024. My goodness.
It's our 25th year.
Wow.
We began in 2000.
Wow, absolutely phenomenal. Well, the Kaleidoscope thanks you. Hopefully people will hear this, see it, and reach out to you. And what is your website, Adrian?
thepositivecommunity.com.
Excellent.
Right. For the radio, go to thepositivecommunity.com, press the radio tab, open you up to a world of the very best of what we have.
Awesome. And you are both the very best of what we have in ethnic media. Thank you again.
Thank you so
much for being on future shows.
Thank you.
Bye now.
Bye-bye.
You've been tuning into The Kaleidoscope, Healthcare in a Diverse America from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.